Dear students, welcome back. In this session, we are going to discuss about introduction to the spine or the vertebral column biomechanics. The vertebral column is one of the axial skeletal joint complexes which are found in our body. Okay, so if you see the design of the structural elements and the systems of linkages uniting the elements allows the column to fulfill a variety of functions. If you see the functions of the vertebral column, it forms the base of support for the head and the internal organs. It also forms a stable base for the attachment of ligaments, bones, and the muscles of the extremities, rib cage, and the pelvis. Okay, and it forms a link between the upper and the lower extremities, and it helps in the mobility of the trunk. Okay, in addition to all these functions, it also gives protection to the spinal cord. Okay, so if you see these functions, some functions require structural stability, whereas others require mobility. Normally, the structural requirements for stability is quite opposite to the structural requirements of the mobility. But in the case of vertebral column, the design of the structure of the vertebral column is capable of meeting both the functions, that is stability and the mobility. So the vertebral column structure is incredibly a complex structure. So to understand the complexity of this structure and its function, firstly we are going to discuss about the structure of the vertebral column. So how many bones which forms the structure, and what are the regions of the vertebral column, okay, and what are the curves which are present in the vertebral column and what is its importance. Like this we are going to discuss in the general structure. After that we are going to discuss about what do you mean by mobile segment. After discussing the mobile segment, we are going to discuss about the typical vertebrae of the vertebral column. That means typical vertebrae includes vertebral body and the neural arch, isn't it? There are some variations we can see in different regions, like in the cervical region, thoracic and lumbar. So the typical vertebrae will show some variations. All those things we are going to discuss in the typical vertebrae. After that we are going to discuss about the intervertebral discs. After discussing the intervertebral disc, we are going to discuss about the articulations found in the entire vertebral column. Normally two articulations are found. One is the cartilaginous joints and then the synovial joints. So, and only one plane synovial joints which is found at the C1 and C2 vertebrae. Okay, and the remaining are synovial joints. And if you see the cartilaginous joints which are present between the vertebral bodies and the interposed discs. Okay, these are the articulations. We are going to discuss these articulations in detail. After that, we are going to discuss about the ligaments attached to the vertebral column. These can be studied under two headings. One is intersegmental system and intrasegmental system. Like that we are going to discuss in the ligaments of the vertebral column. And then the simple classification of the muscles attached to the vertebral column. So like that, what do you mean by the simplest classification means? the classification mainly done on the basis of its function, like forward flexors, lateral flexors, rotators and extensors. Like that, we are going to discuss about the muscles attached to the vertebral column as a whole. Okay, after finishing all these things, we are going to discuss about the function of the vertebral column as a whole, which includes kinematics and kinetics, So the kinematics deals with the mobility of the vertebral column, whereas the kinetics deals with the stability. What are the forces which causes stability not only during movement but also at rest? So these are the things we are going to discuss in the kinetics of the vertebral column as a whole. After finishing all these discussions as a whole, we are going to discuss the same features in different regions. One is cervical region, thoracic region, lumbar region and sacral region. All the pelvis is not a part of the vertebral column, but the attachment of vertebral column through sacroiliac joints and its relationship with the lumbar region. So we are going to discuss about the sacroiliac joints also in the sacral regions, and also the muscles are related to the sacral region. Okay. In the cervical region, we are going to discuss the muscles separately, whereas in the case of thorax and lumbar, so both the region muscles are interdependent muscles in function. So we are going to discuss as a whole as muscles of the trunk. Okay, so after finishing all these regions, we are going to discuss about effects of aging, disease, injury. Okay, and finally I'm going to discuss about a model, how to determine the deficits of a case, okay, of a condition we can discuss at last. So in the next video we are going to discuss about the general structure of the vertebral column. Thank you.